Hello, everyone. I'm Janelle Moos, the Advocacy Director with AARP North Dakota. AARP has been working to promote the health and well-being of older Americans for more than 60 years. And with these short videos, we hope we can provide you with some information that may be helpful during the coronavirus outbreak. With me today is Marina Spahr, an Assistant Attorney General and the Director of the North Dakota Medicaid Fraud Control Unit with the North Dakota Attorney General's Office. Marina, thanks for joining me today.
Thank you. It's a pleasure, Janelle.
So last year, North Dakota became the last state to establish a Medicaid Fraud Control Unit. Can you tell us a little bit about yourself and the unit?
Yeah, I sure can. I've been an attorney for 26 years. The first 20 of those were spent as a state's attorney in Griggs County, which is a part-time position. And so then I was able to have a civil practice and do family law mediation as well. Just before I came to the Attorney General office, I was a senior assistant state's attorney in Burleigh County for 4 years. At Burleigh County, I handled major felony crimes like assaults, murders, child abuse, sexual assaults, and the ever-increasing crimes of elder abuse and elder financial exploitation. I was handling more and more financial crimes where elders were defrauded of large amounts of money. And so moving to the Medicaid Fraud Control Unit was a step further into the realm of investigating major financial crimes.
And well, it sounds like you're a perfect fit for that. So can you tell us a little bit about what the unit does?
Yes, and I should probably lead in with who's in our unit. So right now there are 5 of us in the unit. There's myself, the director, and the only attorney. There are 2 investigators that are BCI trained investigators, and they of course investigate all the complaints that come in. There's also an administrative assistant who tries to keep all of us moving in the right direction. And then most recent staff member is an auditor analyst, and she analyzes all of the payment information, looks at the coding, and helps us decipher all of the medical information that way. And you had asked also, what steps did we take to become a unit? North Dakota has had this kind of request in front of the legislature for at least the past 10 years. They've been trying to establish this unit. Everything came together in 2019. Lonnie Grabowska was the director of the BCI, and he was really instrumental in getting all of the information to the legislature. And once they passed Bill 2347, then our Attorney General, Wayne Stensham, applied for federal certification. He had to provide a budget and a business plan. That was approved. And once it was approved, then the actual formation of the unit began, and the grant process, which provides federal funding for the unit, came into place. I started working for the unit at the end of October in 2019. And fix that, there we go. Our unit is federally funded to a certain extent. So for the first 3 years, 90% of our budget is paid through the federal grant. And all the years thereafter, 75% of it comes from a federal grant.
That's excellent. So, a lot of states have had these types of Medicaid control fraud units since the 1970s. What cases or what types of cases can you investigate in your unit?
We have 2 main types of cases that we have jurisdiction to investigate. And the first is Medicaid provider fraud. So those are what we call the financial cases, the financial fraud. There are many, many types of financial fraud, too many for me to even list. But some of them would be billing Medicaid for services not rendered, double billing for more services that are performed, falsely diagnosing someone so that Medicaid will pay for more services, ordering tests that patients don't need. There lately has been a lot of instances where we're seeing sham clinics that are set up that don't provide any services, but that are billing Medicaid. You can have employees in a facility that are not certified to provide medical assistance or behavioral health assistance, but they're being billed as professionals, so the facility is getting much higher pay than they should. Falsely inflating reimbursement rates. So it's kind of endless, an endless run of ways that people can defraud the system. The second type of case are abuse, neglect, and financial exploitation of patients that are in healthcare facilities that receive Medicaid funding or any board and care facility. So an example of that type of case might include failure to provide proper care in the facility or proper medical care. Sometimes you might have severely understaffed facilities that leads to neglect of patients, or physical or sexual abuse, homicides that occur in a facility, thefts of money, jewelry, assets. Our jurisdiction is limited to, though, the crimes or the bad actions have to be committed by someone working at the facility or a managing person in the facility. It can't be a family member of a resident or something like that.
Wow. So your jurisdiction and really what the comprehensiveness of this unit is really expansive, which I think is so important. You know, AARP North Dakota has been doing a lot of advocacy on behalf of residents living in long-term care facilities and nursing homes. So I really see this as such a super important asset for families to make sure that their residents living in those facilities are taken care of. So are you investigating cases right now, or are there, how are cases reported to you to investigate?
Janelle, and just to start that, just so that everyone knows, we have statewide jurisdiction. So we may be located in Bismarck, but we have jurisdiction across the entire state in any of the counties, towns, townships, you name it. We are investigating cases. We've had about 20 reports. 10 of those are active investigations right now, and we filed charges in one criminal case in Pembina County. We receive a lot of our referrals or complaints from the Program Integrity Unit at the Department of Human Services. And they are already looking at provider billing. So when they see something suspicious, they make sure that it comes to our unit. But anyone can make a report. A resident at a facility, a family member, law enforcement, and that can be done through our website, mail, telephone, in-person contact. Will take complaints in all ways. And we've noticed and been informed of nationwide trends lately that are occurring and in the COVID-19 fraud area. Be cautious of unsolicited requests for Medicaid or Medicare numbers. What's happening there is when someone gets those numbers, then they're used to bill Medicaid for an endless amount of services that never, ever happened. Be suspicious of any unexpected calls or visitors that are offering COVID-19 testing supplies. Those, of course, should come from your healthcare facilities. And it's also just another way for someone to initially get your Medicaid or Medicare numbers and then kind of go wild with it. Online offers for vaccinations or cures, they're certainly a scam. Double check all charities that are asking for donations. And if a patient is in a nursing home or a basic care facility, and they've been required to give that facility their stimulus money, that's a problem too. All the stimulus money is for the patient to use over the next 12 months and can't be taken by the facility. So just in the past couple of weeks, we've had a lot of questions about that. There were a few facilities that were maybe not receiving the correct information, and they were very good to work with. Once we explained that this is actually a tax credit, if they took the stimulus money to begin with, then they gave it right back. So those were cleared up quickly, but that's part of our project too, is to help inform both residents and entities on new issues like this.
I think that's excellent, Marina. We get calls and questions all the time here at AARP North Dakota regarding fraud and really our membership is concerned about what is legitimate and what isn't. So I think we've really valued the partnership with the North Dakota Attorney General's office with our fraud protection work to make sure that, folks are educated about the scams that are out there, but they can take really great steps forward to make sure that to keep themselves safe and keep their identity safe. So I think it's really excellent now that we've added you and your staff as another additional resource and tool for our membership to make sure that they understand, what's out there and how to report things that look fraudulent. So I think that's excellent.
Yeah.
So your unit, do you often see Medicaid and Medicare fraud in the same investigation, and how so? Or what are other cases? I know since this unit in North Dakota is so new, are there other examples of cases in states that are investigating cases like that now?
Yeah. Often, and at this point, I'd almost say most often, if someone is defrauding Medicaid, they're also defrauding Medicare or private insurance or TRICARE. So even in the investigations that we have, we always look to that other set of information, and often we're seeing, yes, there's a crossover of fraud in all those other cases. There are examples from other states. That's almost an endless endeavor. We get updates from many different areas. And just this past week, I'll give you some examples of cases that we're seeing nationwide. It gets a little long because there are so many, but like I say, this is just a sampling. So in North Carolina, and I should say these reports I get are just of cases that are settled this week. It's not all the ones that have been charged nationwide. It's just the ones that were somehow settled or sentenced. So out of North Carolina, there was a case where $13 million were fraudulently taken from Medicaid. According to the indictment, two individuals worked together to carry out a massive fraud upon the North Carolina Medicaid program. They were billing government for fictitious home health services. Then they worked together to launder the proceeds of the fraud into things like private jets, luxury jewelry, clothing, and property. In another case, a drug and alcohol rehabilitation organization that had multiple treatment centers in Pennsylvania overbilled, and they were actually buying insurance for patients' names, paying for it, and then billing that new insurance for expensive treatments that were never performed. The major player was sentenced to 37 months in prison and had to pay $3 million in restitution. A case out of Los Angeles involved distribution of opioids through sham clinics. Medicaid and Medicare were defrauded. 13 defendants provided large kickbacks to doctors who then wrote fraudulent prescriptions for the defendants. Or when they couldn't find the doctors to cooperate, they stole identities of other doctors and just wrote fake prescriptions themselves. More than 2 million controlled prescription pills were sold on the black market through that scheme. The main defendant or major player in that also was sentenced to 9 years of jail time. Another joint Medicare scam involved a pharmacist in Ohio who submitted claims for drugs not actually prescribed or given to patients. And he was sentenced to 37 months in jail in order to pay back more than $1 million and forfeit some of the property that he had purchased, like cars and land. And it goes on and on and on.
Wow, that's really incredible, especially in light of what you're saying, that those are just the ones that have been, been investigated and prosecuted. I think this unit is so important and such a great addition to our state. So do you work with those other Medicaid fraud control units in those states, or what's your partnership look like in terms of federal investigation and prosecution?
So as far as the other 50 states and territories, we don't necessarily cooperate with them on an investigation where we, work together and go to court together. But what they do is, since they've all been in this business for a long time, they provide me with all kinds of advice and forms and direction on how to set up the unit. Or if I'm having trouble kind of seeing how a case should work, I'll call them up, and they've done hundreds of those types of cases. So they've all been extremely supportive, all the other units. But our federal grant absolutely requires us to cooperate with federal investigators and prosecutors that are working their cases, and to cooperate on ours as well. We appreciate that type of collaboration and the resources the federal partners can bring to us. We often contact federal investigators in our area to ask for help in investigating a case. And we have regular meetings with our federal counterparts to discuss cases and strategies. Before we had to step back and work from home and had COVID-19 issues, we were meeting often monthly to have, kind of case meetings. But we talk with our federal counterpart investigators weekly and work with them.
I mean, it's excellent that you have that resource to draw from, especially as you're starting up this unit. This has been so helpful. Are there any tips or resources that you'd like to share with our viewers?
Yes. So if you want to make a complaint, the best way to do that is by filling out a complaint on the Attorney General website. And that's attorneygeneral.nd.gov. And I see that it's up on your screen. So under Attorney General, there's a drop-down box on the left-hand side. And if you went to that, Medicaid fraud is the very last line, and you click that, and I think we're just headed there. And that's our initial website page. So as our unit goes along and over the next couple of months, we'll add a lot of more resources and kind of frequently asked questions to this page. But for now, it contains our complaint. So you can click on that and fill out a complaint. It also contains our contact information. So if you didn't want to fill out the complaint online, it has our email, our telephone number, and contact information. And so you can get a hold of us in any of those ways.
Okay, that's really helpful. I think you've made it really easy for folks to find out more about the control unit, as well as how to make that report. So thanks again for joining me today. For our viewers, just a couple of quick reminders here. We have AARP's coronavirus resources and just how to stay connected with us here at AARP North Dakota. You can connect with us via our Facebook page at facebook.org/AARP North Dakota. You can like our page, and you can see coming up other feature stories that we'll be including for you during this time. You can also find excellent resources on our website at aarp.org/ND. Thanks again for joining us, and stay connected with us online. And until we can see you in person again, we'll see you soon. Thanks.
Thank you very much, Janelle.
Absolutely. Thank you.
Bye-bye.